Hey, Alphanurses, I'm Licensure from alphanurseguy.com. This is 30 practice NCLEX questions. Without the way, let's get started.
A client who has undergone a mitral valve replacement has persistent bleeding from a sternal incision during the early postoperative period. The nurse should do which of the following? Select all that apply. 1. Administer warfarin. 2. Check the postoperative CBC, INR, PTT, and platelet levels. 3. Confirm availability of blood products. 4. Monitor the mediastinal chest tube drainage. 5. Start a dopamine drip for a systolic BP less than 100. The correct answers are 2, 3, and 4. The hemoglobin and hematocrit should be assessed to evaluate blood loss. An elevated INR and PTT and decreased platelet count increase the risk for bleeding. The client may require blood product depending on lab values and severity of bleeding. Therefore, availability of blood products should be confirmed by calling the blood bank. Close monitoring of blood loss from the mediastinal chest tubes should be done. Warfarin is an anticoagulant that will increase bleeding. Anticoagulation should be held at this time. Information is needed on the type of valve replacement. For mechanical heart valve, the INR is kept at 2 to 3.5. Tissue valves do not require anticoagulation. Dopamine should not be initiated if the client is hypotensive from hypovolemia. Fluid volume assessment should always be done first. Volume replacement should be initiated in a hypovolemic client prior to starting an inotrope, such as dopamine. A 4-year-old has been scheduled for a cardiac catheterization to help prepare the family. The nurse should 1. Advise the family to bring the child to the hospital for a tour a week in advance. 2. Explain that the child will need a large bandage after the procedure. 3. Discourage bringing favorite toys that might become associated with pain. 4. Explain that the child may get up as soon as the vital signs are stable. The correct answer is 2. The catheter insertion site will be covered with a bandage. This is important for preschool children to know, as they are very concerned about bodily harm. The best time to prepare a preschool child for an invasive procedure is the night before. Bringing a favorite toy to the hospital will help decrease the child's anxiety. To prevent bleeding, the child will be expected to keep the extremity straight for 4 to 6 hours after the procedure, either in bed or on the parent's lap. Which of the following physical assessment findings are normal for a client with advanced chronic obstructive pulmonary disease? 1. Increased anteroposterior chest diameter. 2. Underdeveloped neck muscles. 3. Collapsed neck veins. 4. Increased chest excursions with respiration. The correct answer is 1. Increased anteroposterior chest diameter is characteristic of advanced COPD. Air is trapped in the overextended alveoli, and the ribs are fixed in an inspiratory position. The result is the typical barrel-chested appearance. Overly developed, not underdeveloped, neck muscles are associated with COPD because of their increased use in the work of breathing. Distended, not collapsed, neck veins are associated with COPD as a symptom of the heart failure that the client may experience secondary to the increased workload on the heart to pump blood into the pulmonary vasculature. Diminished, not increased, chest excursion is associated with COPD. The major goal of nursing care for a client with heart failure and pulmonary edema is to 1. Increase cardiac output. 2. Improve respiratory status. 3. Decrease peripheral edema. 4. Enhance comfort. The correct answer is 1. Increasing cardiac output is the main goal of therapy for the client with heart failure or pulmonary edema. Pulmonary edema is an acute medical emergency requiring immediate intervention. Respiratory status and comfort will be improved when cardiac output increases to an acceptable level. Peripheral edema is not typically associated with pulmonary edema. The nurse is reviewing the history and physical and physician prescriptions on the chart of a newly admitted client. The chart reads, 19-year-old reports a constant cough for the past few weeks with dark sputum for the past few days. Has night sweats, 10 pounds weight loss in past month, and always being tired. He took 1 Tylenol about an hour prior to arrival. BP is 120/64. Heart rate is 84 with regular rhythm. Respiration is 26, unlabored. Slight wheezing in right lower lobe posteriorly. Oxygen saturation is 92%. Temperature is 99.9 degrees Fahrenheit orally. Skin is warm and slightly diaphoretic. The patient has non-productive cough at this time. Nursing assessment reveals possible respiratory infection. The HCP orders chest X-ray, sputum specimen, and oxygen at 2 liters per nasal cannula. The nurse should first 1. Initiate airborne precautions. 2. Apply oxygen at 2 liters per nasal cannula. 3. Collect a sputum sample. 4. Reassess vital signs. The correct answer is 1. There is a high risk and potential for tuberculosis, and airborne precautions should be implemented immediately to prevent the spread of infection. After initiating precautions, a nurse can start the oxygen, check the vital signs, and collect the sputum specimen. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A young woman comes to the mental health clinic for her routine medication follow-up. She has been married for 2 years and reports that she and her husband are ready to start a family. She has a diagnosis of bipolar 1 disorder and has been well managed on D-valproic sodium Depakote for at least 3 years. What is the most essential counsel for the nurse to give her? 1. Schedule an appointment for a complete gynecological exam if you have not had one in the past year. 2. Pay careful attention to eating healthy from this point on in order to maximize the health of both mother and baby. 3. Check with your prescriber today as Depakote carries an increased risk for birth defects, especially during the first 3 months of pregnancy. 4. It is very important for you to take steps to reduce your stress, and this will help you to stay in balance during your pregnancy and reduce your chances of developing postpartum depression. The correct answer is 3. All of these options need to be addressed. However, it is vital that this young woman receive counseling about the serious birth defects that have an increased incidence with the taking of Depakote during the first trimester of pregnancy. These problems include craniofacial abnormalities, organ malformations, limb deficiencies, and developmental delays. The chances of preeclampsia and premature labor are also increased. After conducting a presentation to a group of adolescent parents on the topic of adolescent pregnancy, the nurse determines that one of the parents needs further instruction when the parent says that adolescents are at greater risk for which of the following? 1. Denial of the pregnancy. 2. Low birth weight infant. 3. Cephalopelvic disproportion. 4. Congenital anomalies. The correct answer is 4. Additional teaching is needed when the parent says that adolescents are at greater risk for congenital anomalies. Although adolescents are at greater risk for denial of the pregnancy, lack of prenatal care, low birth weight infant, cephalopelvic disproportion, anemia, and nutritional deficits, and have a higher maternal mortality rate, studies reveal that congenital anomalies are not more common in adolescent pregnancies. A toddler who has been treated for a foreign body aspiration begins to fuss and cry when the parents attempt to leave the hospital for an hour. The parents will be returning to take the toddler home. As the nurse tries to take the child out of the crib, the child pushes the nurse away. The nurse interprets this behavior as indicating separation anxiety, involving which of the following? 1. Protest. 2. Despair. 3. Regression. 4. Detachment. The correct answer is 1. Young children have specific reactions to separation and hospitalization. In the protest stage, the toddler physically and verbally attacks anyone who attempts to provide care. Here, the child is fussing and crying and visibly pushes the nurse away. In the despair stage, the toddler becomes withdrawn and obviously depressed. Regression is a return to a developmentally earlier phase because of stress or crisis. Denial or detachment occurs if the toddler stay in the hospital without the parent is prolonged because the toddler settles into the hospital life and denies the parent's existence. Which of the following is an expected outcome for an elderly client following treatment for bacterial pneumonia? 1. A respiratory rate of 25 to 30 breaths per minute. 2. The ability to perform activities of daily living without dyspnea. 3. A maximum loss of 5 to 10 pounds of body weight. 4. Chest pain that is minimized by splinting the rib cage. The correct answer is 2. An expected outcome for a client recovering from pneumonia would be the ability to perform activities of daily living without experiencing dyspnea. A respiratory rate of 25 to 30 breaths per minute indicates the client is experiencing tachypnea, which would not be expected on recovery. A weight loss of 5 to 10 pounds is undesirable. The expected outcome would be to maintain normal weight. A client who is recovering from pneumonia should experience decreased or no chest pain. Penicillin has been prescribed for a client admitted to the hospital for treatment of pneumonia. Prior to administering the first dose of penicillin, the nurse should ask the client, 1. Do you have a history of seizures? 2. Do you have any cardiac history? 3. Have you had any recent infections? 4. Have you had a previous allergy to penicillin? The correct answer is 4. The nurse should determine if the client is allergic to penicillin prior to administering the drug. History of seizures, recent infections, and a cardiac history are not contraindications for this client for receiving penicillin. While it is important to know, recent infections will not preclude this client receiving penicillin at this time. A 17-year-old client at 33 weeks gestation diagnosed with mild preeclampsia is treated as an outpatient. The nurse instructs the client to contact a healthcare provider immediately if she experiences which of the following? 1. Blurred vision. 2. Ankle edema. 3. Increased energy levels. 4. Mild backache. The correct answer is 1. Severe headache, visual disturbances, such as blurred vision, and epigastric pain are associated with the development of severe preeclampsia and possibly eclampsia. These danger signs and symptoms must be reported immediately. Severe headache and visual disturbances are related to severe vasoconstriction and a severe increase in blood pressure. Epigastric pain is related to hepatic dysfunction. Ankle edema is common during the third trimester. However, facial edema is associated with increased fluid retention and progression from mild to severe preeclampsia. Increased energy levels are not associated with the progression of the client's preeclampsia or the development of complications. In fact, some women report an energy spurt before the onset of labor. Mild backache is a common discomfort pregnancy, unrelated to progression of the client's preeclampsia. It also may be associated with bed rest when the mattress is not firm. Some multiparous women have reported a mild backache as a sign of impending labor. Which of the following findings would most likely indicate the presence of a respiratory infection in a client with asthma? 1. Cough productive of yellow sputum. 2. Bilateral expiratory wheezing. 3. Chest tightness. 4. Respiratory rate of 30 breaths per minute. The correct answer is 1. A cough productive of yellow sputum is the most likely indicator of a respiratory infection. The other signs and symptoms, wheezing, chest tightness, and increased respiratory rate, are all findings associated with an asthma attack and do not necessarily mean an infection is present. The nurse should teach the client who is receiving warfarin sodium that 1. Partial thromboplastin time values determine the dosage of warfarin sodium. 2. Protamine sulfate is used to reverse the effects of warfarin sodium. 3. International normalized ratio is used to assess effectiveness. 4. Warfarin sodium will facilitate clotting of the blood. The correct answer is 3. INR is a value used to assess effectiveness of the warfarin sodium therapy. Partial thromboplastin time is used to assess the effectiveness of heparin therapy. Fresh frozen plasma or vitamin K is used to reverse warfarin sodium's anticoagulant effect, whereas protamine sulfate reverses the effects of heparin. Warfarin sodium will help to prevent blood clots. Discharge teaching for a 3-month-old infant with a cardiac defect who is to receive digoxin should include which of the following? Select all that apply. 1. Give the medication at regular intervals. 2. Mix the medication with a small volume of breast milk or formula. 3. Repeat the dose one time if the child vomits immediately after administration. 4. Notify the primary care provider of poor feeding or vomiting. 5. Make up any missed doses as soon as realized. 6. Notify the primary care provider if more than 2 consecutive doses are missed. The correct answers are 1, 4, and 6. To achieve optimal therapeutic levels, digoxin should be given at regular intervals without variation, usually every 12 hours. Vomiting and poor feeding are signs of toxicity. If more than 2 consecutive doses are missed, interventions may be needed to assure therapeutic drug levels. The medication should not be mixed with any other fluid, as refusal may result in inaccurate intake of the medication. Taking make-up doses or taking the medication at times other than scheduled may adversely affect serum levels. Which of the following is a priority goal for the client with chronic obstructive pulmonary disease? 1. Maintaining functional ability. 2. Minimizing chest pain. 3. Increasing carbon dioxide levels in the blood. 4. Treating infectious agents. The correct answer is 1. A priority goal for client with COPD is to manage the signs and symptoms of the disease process so as to maintain the client's functional ability. Chest pain is not a typical symptom of COPD. The carbon dioxide concentration in the blood is increased to an abnormal level in clients with COPD. It would not be a goal to increase the level further. Preventing infection would be a goal of care for the client with COPD. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguy.com. Back to the questions. The nurse teaches a client with heart failure to take oral furosemide in the morning. The primary reason for this is to help 1. Prevent electrolyte imbalances. 2. Slow rapid drug absorption. 3. Excrete excessive fluids accumulated during the night. 4. Prevent sleep disturbances during the night. The correct answer is 4. When diuretics are given early in the day, the client will void frequently during the daytime hours and will not need to void frequently during the night. Therefore, the client's sleep will not be disturbed. Taking furosemide in the morning has no effect on preventing electrolyte imbalances or slowing rapid drug absorption. The client should not accumulate excessive fluids throughout the night. The nurse is reconciling prescriptions for a client diagnosed recently with pulmonary tuberculosis who is being admitted to the hospital for a total hip replacement. The medication prescription sheet says isoniazid 300 milligrams PO daily, rifampin 600 milligrams PO daily, pyridoxine 10 milligrams PO daily, ethambutol 400 milligrams PO daily, and pyrazinamide 1.5 grams PO daily. The client asks if it is necessary to take all of these medications while in the hospital. The nurse should 1. Request that the healthcare provider review the prescriptions for a duplication between isoniazid and ethambutol. 2. Inform the client that all drugs will be discontinued until the client can eat solid foods. 3. Ask the pharmacist to check for drug interactions between the rifampin and isoniazid. 4. Tell the client that it is important to continue to take the medications because the combination of drugs prevents bacterial resistance. The correct answer is 4. The nurse should tell the client that it is necessary to take all of these medications because combination drug therapy prevents bacterial resistance. They will be administered throughout the hospitalization to maintain blood levels. The healthcare provider will review the prescriptions per hospital policy because the client is being admitted to hospital. There is no duplication between any of the drugs being prescribed for this client. It is not necessary to ask the pharmacist to check for drug interactions, as these drugs are commonly used together. A client states to a nurse, "Hey, sweetie, you're looking good today." Which of the following responses by the nurse is best? 1. Thank you for being so kind and thoughtful. 2. I know you are only teasing me. 3. My name is Molly, and I am a nurse on a unit today. 4. I am not here to receive compliments from clients. The correct answer is 3. The nurse states her identity and purpose for being on the unit to clarify any misperception by the client. Thank you for being so kind. I know you are only teasing me, and I am not here to receive compliment from clients, are non-therapeutic statements, and do not clarify the nurse's identity and purpose. A multigravida client, who stand for long periods while working in a factory, visits the prenatal clinic at 35 weeks gestation, stating, "The varicose veins in my legs have really been bothering me lately. Which of the following instructions would be helpful? 1. Perform slow contraction and relaxation of the feet and ankles twice daily. 2. Take frequent rest periods with the legs elevated above the hips. 3. Avoid support holds that reach above the leg varicosities. 4. Take a leave of absence from your job to avoid prolonged standing." The correct answer is 2. The client with leg varicosities should take frequent rest periods with the legs elevated above the hips to promote venous circulation. The client should avoid constrictive clothing, but support hose that reach above the varicosities may help alleviate the pain. Contracting and relaxing the feet and ankles twice daily is not helpful because it does not promote circulation. Taking a leave of absence from work may not be possible because of economic reasons. The client should try to rest with her legs elevated or walk around for a few minutes every 2 hours while on the job. A premigravida client has completed her first prenatal visit and blood work. Her laboratory test for the hepatitis B surface antigen is positive. The nurse can advise the client that the plan of care for this newborn will include which of the following? Select all that apply. 1. Hepatitis B immune globulin at birth. 2. Series of 3 hepatitis B vaccinations per recommended schedule. 3. Hepatitis B screening when born. 4. Isolation of infant during hospitalization. 5. Universal precautions for mother and infant. 6. Contraindication for breastfeeding. The correct answers are 1, 2, and 5. The test result indicates that the mother has an active hepatitis infection and is a carrier. Hepatitis B immune globulin at birth provides the infant with passive immunity against hepatitis B and serves as a prophylactic treatment. Additionally, the infant will be started on the vaccine series of 3 injections. The infant should not be screened or isolated because the infant is already hepatitis B positive. As with all clients, universal precautions should be used and are sufficient to prevent transmission of the virus. Women who are positive for hepatitis B surface antigen are able to breastfeed. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A nurse is teaching the parents of a preschooler about the possibility of postoperative hemorrhage after a tonsillectomy and adenoidectomy. The nurse should explain that the risk is greatest at which of the following times? 1. 1 to 3 days after surgery. 2. 4 to 6 days after surgery. 3. 7 to 10 days after surgery. 4. 11 to 14 days after surgery. The correct answer is 3. The risk of hemorrhage from a tonsillectomy is greatest when the tissue begins sloughing and the scabs fall off. This typically happens 7 to 10 days after a tonsillectomy. Which of the following measures would most likely be successful in reducing pleuritic chest pain in a client with pneumonia? 1. Encourage the client to breathe shallowly. 2. Have the client practice abdominal breathing. 3. Offer the client incentive spirometry. 4. Teach the client to splint the rib cage when coughing. The correct answer is 4. The pleuritic pain is triggered by chest movement and is particularly severe during coughing. Splinting the chest wall will help reduce the discomfort of coughing. Deep breathing is essential to prevent further atelectasis. Abdominal breathing is not as effective in decreasing pleuritic chest pain as a splinting of the rib cage. Incentive spirometry facilitates effective deep breathing, but does not decrease pleuritic chest pain. A child with Kawasaki disease is receiving low-dose aspirin. The mother calls a clinic and states that the child has been exposed to influenza. Which recommendations should the nurse make? Select all that apply. 1. Increase fluid intake. 2. Stop the aspirin. 3. Keep the child home from school. 4. Watch for fever. 5. Weigh the child daily. The correct answers are 2 and 4. Aspirin needs to be stopped because of its possible link to Rice syndrome. Additionally, the parents need to watch for signs and symptoms of influenza. Children with influenza, frequently present with fever, cold symptoms, and gastrointestinal symptoms. Increasing the child's fluid intake and weighing the child daily are not needed at this time because the child is not ill. Keeping the child home from school is not necessary because the child is not ill and has already been exposed. What areas of education should the nurse provide employees in a factory making products that cause respiratory irritation to reduce the risk of laryngeal cancer? Select all that apply. 1. Stopping smoking. 2. Using a HEPA filter in the home. 3. Limiting alcohol intake. 4. Brushing teeth after every meal. 5. Avoiding raising the voice to be heard over the noise in a factory. The correct answers are 1 and 3. The primary risk factors for laryngeal cancer are smoking and alcohol intake. Smoking cessation is most successful with a support group or counseling. Heavy drinking should be avoided since the risk increases with the amount of alcohol consumption. HEPA filters help trap small particles and allergens to reduce allergy symptoms and asthma. Poor oral hygiene is not a risk factor, nor is overusing the voice. After surgery to correct a tetralogy of Fallot, the child's parents express concern to the nurse that their 4-year-old child wants to be held more frequently than usual. The nurse recommends 1. Introducing a new skill. 2. Play therapy. 3. Encouraging behavior. 4. Having the volunteer hold the child. The correct answer is 2. The child is exhibiting regression. During periods of stress, children frequently revert to behaviors that were comforting in earlier developmental stages. Play therapy is one way to help the child cope with the stress. Teaching a new skill most likely would add more stress. Parents should be instructed to praise positive behaviors and ignore regressive behaviors rather than calling attention to them through encouragement or discouragement. Having someone else hold the child does not encourage coping with the stress or promoting appropriate development. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A 34-year-old female with a history of asthma is admitted to the emergency department. The nurse notes that the client is dyspneic, with a respiratory rate of 35 breaths per minute, nasal flaring, and use of accessory muscles. Auscultation of the lung fields reveals greatly diminished breath sounds. Based on these findings, which action should the nurse take to initiate care of the client? 1. Initiate oxygen therapy as prescribed and reassess the client in 10 minutes. 2. Draw blood for an arterial blood gas. 3. Encourage the client to relax and breathe slowly through the mouth. 4. Administer bronchodilators as prescribed. The correct answer is 4. In an acute asthma attack, diminished or absent breath sounds can be an ominous sign indicating lack of air movement in the lungs and impending respiratory failure. The client requires immediate intervention with inhaled bronchodilators, IV corticosteroids, and possibly IV theophylline. Administering oxygen and reassessing the client 10 minutes later would delay needed medical intervention, as with drawing blood for an arterial blood gas analysis. It would be futile to encourage the client to relax and breathe slowly without providing the necessary pharmacologic intervention. A client with aortic stenosis has increasing dyspnea and dizziness. Identify the area where the nurse would place the stethoscope to assess a murmur from aortic stenosis. Choose option 1, 2, 3, 4, or 5 from the picture. The correct answer is option 1. The stethoscope is placed at the second intercostal space right of sternum to assess the aortic area as seen in option 1. Option 2 is a pulmonic valve area. Option 3 is Erb's point. Option 4 is a tricuspid valve area. And option 5 is the mitral valve area. A client with tuberculosis is taking isoniazid, INH, to help prevent development of peripheral neuropathies. The nurse should instruct the client to 1. Adhere to a low cholesterol diet. 2. Supplement the diet with pyridoxine. 3. Get extra rest. 4. Avoid excessive sun exposure. The correct answer is 2. INH competes for the available vitamin B6 in the body and leaves the client at risk for development of neuropathies related to vitamin deficiency. Supplemental vitamin B6 is routinely prescribed. Following a low cholesterol diet, getting extra rest, and avoiding excessive sun exposure will not prevent the development of peripheral neuropathies. When asked about her stresses before admission, an anxious client stares blankly at the nurse and mutters unintelligibly. Which of the following descriptions of the client's behaviors should the nurse document in the client's chart? 1. Client cannot answer any questions asked at this time. 2. Client is uncooperative during the admission procedure, refusing to answer any questions. 3. Client responded to questions with a blank look and incomprehensible mumble. 4. Client stared at the wall when asked questions and was disoriented and incoherent. The correct answer is 3. The nurse must be objective in documenting the client's behavior, recording exactly what the client did or did not say or do in a particular situation. Recording that the client could not answer any questions, was uncooperative and refused to answer questions, or was disoriented and incoherent is not described and is a subjective interpretation on the nurse's part. A client has a history of heart failure and has been taking furosemide Lasix, digoxin, lanoxin, and potassium chloride. The client has nausea, blurred vision, headache, and weakness. The nurse notes that the client is confused. The telemetry strip shows first-degree atrioventricular block. The nurse should assess the client for signs of which of the following? 1. Hyperkalemia. 2. Digoxin toxicity. 3. Fluid deficit. 4. Pulmonary edema. The correct answer is 2. Early symptoms of digoxin toxicity include anorexia, nausea, and vomiting. Visual disturbances can also occur, including double or blurred vision and visual halos. Hypokalemia is a common cause of digoxin toxicity associated with arrhythmias because low serum potassium can enhance ectopic pacemaker activity, although vomiting can lead to fluid deficit. Given the client's history, the vomiting is likely due to the adverse effects of digoxin toxicity. Pulmonary edema is manifested by dyspnea and coughing. You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguy.com.